Hey, what's going on, guys? This is Tyler, pharmacist with Pharmacy Update, and today we're going to talk about the type 2 diabetes drug Jardiance. If you or someone you know is taking this drug or thinking about taking this drug, this information might be helpful to you. I'll cover how it works, some contraindications and precautions of Jardiance, the side effects, and then at the end of the video I'll discuss a special FDA warning concerning this drug and other drugs in this class. So here we go. First off, what is it used for? The indications for this drug are the treatment of type 2 diabetes, and it can also help reduce cardiovascular events in patients that have type 2 diabetes. So this would be for diabetics that have already had some sort of heart disease, whether that be a previous heart attack or heart failure. It has been found to reduce mortality in these patients. For this reason, it is considered a preferred add-on therapy for patients who take metformin and have an established heart disease. So how does Jardiance work exactly? Well, it's in a drug class that is fairly new. They are known as the sodium glucose cotransporter 2 inhibitors, and normally you'll see that abbreviated as SGLT2 inhibitor. And basically it helps you excrete more glucose through your urine. So in a normal situation, any glucose that is filtered through the kidneys is reabsorbed into the bloodstream. That's because glucose is a very important thing for your body. It's used as an energy source for your normal daily functions, and it provides quite a bit of energy for your cells. So your body does not want to waste any glucose that it gets. That's why if they find glucose in your urine, that usually means that your blood glucose is so high that the kidneys cannot keep up with all the excess glucose, or you have some sort of urinary tract infection. It's not normal to find glucose in your urine. But anyway, if you can block this reabsorption of glucose from your kidneys, you can excrete more from your urine, and doing this can effectively lower your blood glucose levels. Now, having more glucose travel through your urinary tract can cause some issues, which we'll get into. But this is the way that Jardiance lowers blood sugar. Next, I will cover the contraindications and precautions of Jardiance. First here is contraindications, which means that you simply should not take this drug if you have any of these conditions. First one here, severe renal impairment or end-stage renal disease. So if your kidneys are not working properly, this drug really isn't going to work. Like we already talked about, it performs its action in the kidneys. So if the kidneys aren't working properly, there really isn't a reason to take this drug. Also, over 50% of Jardiance is eliminated through the kidneys. So if you have renal disease, you can get increased drug levels in the bloodstream. The manufacturer of Jardiance suggests not starting this drug in patients with a creatinine clearance of under 45 milliliters per minute. And creatinine clearance is just a way of measuring kidney function. Also, patients on dialysis should not take this drug either. On to precautions. So one of the main problems with this drug, and really any SGLT2 inhibitor, is that it can cause an increase in genital and urinary tract infections. And this does make sense because we have more glucose traveling through the urinary tract, and any bacteria or fungus can actually use this glucose for energy. So if you have a long history of getting these type of infections, you may want to think twice before taking an SGLT2 inhibitor, including Jardiance. It can possibly also cause hypotension or low blood pressure because it can make you urinate more often. And there has been some reports of acute kidney injury, especially in people who are already dehydrated. So while taking this medication, just make sure you're keeping your fluids up. If you get some severe diarrhea or vomiting, you may actually want to consider stopping this drug for the time being, but that is ultimately up to your doctor. Also, it can possibly cause an increase in your LDL or bad cholesterol, so just make sure you keep an eye on that. And there's also been some reports of ketoacidosis with this medication. Now we'll move on to side effects. These mostly tie in with the precautions we just discussed. So urinary tract infection is the most common side effect you can experience because of the reasons we talked about. And this is more pronounced in women. Women are at a higher risk for UTIs compared to men just in general. So this side effect can occur in up to 18% of women and around 4% in males. And those that are 75 years and older are at an increased risk of getting this side effect as well. Genital infections are also possible, and this is primarily women that are affected. You can also see an increase in urine output and nausea in a small percentage of people. Now, one nice thing about Jardiance is that hypoglycemia, or low blood sugar, is not very common when used alone. If you are taking other diabetes medications, especially insulin, it can increase the risk of hypoglycemia, but not by much, just because of how the drug works. And that brings us to my final topic, and that is a special warning from the FDA about SGLT2 inhibitors. So this was issued in August of last year. There have been reports of necrotizing fasciitis of the perineum region, and this disease is more commonly known as flesh-eating bacteria. And I believe this was first reported with Invokana, which was the first SGLT2 inhibitor released on the market. But yes, this is a very scary disease and may make you think twice about trying an SGLT2 inhibitor, such as Jardiance. However, just remember that this is a very rare occurrence. It's not very likely to happen to you if you take one of these medications, but it is something you need to keep in the back of your mind. If you happen to develop any pain, tenderness, swelling, or redness in the area between or around your genitals and anus, seek medical attention immediately so they can start treatment. Well, that's all I have for today, guys. I want to thank you for watching. If you'd like to keep up with the latest pharmacy and medical updates, please subscribe to my channel. I'm trying to post at least one video per week to keep you guys updated. So thank you guys again, and have a great day.